The Affordable Care Act is arguably the Obama administration's biggest triumph. And while Republicans have had 7 years to come up with a replacement, Democrats have had the same amount of time to come up with a defense. Here's what some House Democrats had to say about the American health care bill, that Obamacare replacement, on Wednesday.
As President Trump often says, bad, sad. Even if we could all agree that we need to make health care more affordable and accessible, this bill does the opposite. You pay more and you get less. The Republican repeal bill even gives huge tax breaks to the rich while taking away health coverage from millions and millions of Americans, drastically increasing the cost in health insurance, with the biggest increases for seniors and working families.
Today, Republicans give you survival of the fittest, starring health care for the healthy and wealthy. For the rest of Americans, you're going to pay more money, you're going to get less coverage. It is disgraceful, and when people find out about this bill, you're going to wish you don't go anywhere near your hometown town hall meetings.
Time has
You've been
expired.
ducking them, and wait till you go home and get a handful of this.
Some Republicans are criticizing the bill, too, but they're making the opposite argument. They say the bill is too big, it is just more government, it's going to cost too much, and will make health care in America worse. Earlier, I spoke to one of those Republicans, Kentucky Senator Rand Paul. Take a listen. Senator, it appears that you are on the president's mind because he tweeted earlier, "I feel sure that my friend Rand Paul will come along with the news and great health care program because he knows Obamacare is a disaster."
Well, we do agree on some of that. I do agree Obamacare is a disaster. I think we also agree, and I think most Republicans agree, that we should repeal it. We're kind of apart on the replacement part. And that's what I've been saying, that I think the compromise might be if you separate repeal from replacement, they still can be on the same day, but let's vote on repeal like we did about a year ago when we unanimously voted to repeal it.
It can't be an accident that he is going directly to your constituents this weekend.
Probably just a coincidence.
He's speaking in Louisville, Kentucky.
Well, we welcome him to Kentucky. He's very popular in Kentucky. I've been a big ally of his on trying to repeal regulations that are hurting our coal industry. I'm with him on reducing taxes. I'm with him on repealing Obamacare. But I think where the problem is we have some disagreements on the replacement part.
The Speaker of the House had a message for conservatives like yourself. He said, "This is a conservative plan. This is a conservative's dream. It gets rid of the mandates. It gets rid of the taxes. It gets rid of onerous regulations on insurance companies." Why are you still holding out?
I'd call it Obamacare light. It keeps the subsidies, just renames them tax credits. It keeps the taxes, all of them, for a year, and then it keeps the Cadillac tax forever. The individual mandate, where if you don't buy insurance, you have to pay a penalty to government, it just changes it and you have to pay the penalty to the insurance company. There's $100 billion in there that's simply a bailout for insurance companies. The insurance companies have all said that the individual market doesn't work. If you say people can get insurance after they're sick, it doesn't work when you take the individual mandate away. It didn't work with the individual mandate. It's going to get worse. If you keep the guaranteed issue that people can get insurance after they're sick, they will. So my prediction is if you pass the Obamacare light bill, you know what? Insurance premiums are still going to go up and you're going to have to bail out the insurance companies. That's why they put in there $100 billion to bail out the insurance companies.
But Republican leaders say they are living with the political reality that people have been relying on Obamacare subsidies for years now. They've been relying on this expansion of Medicaid, and you can't just rip that away as much as they'd like to.
Well, a year ago we voted on a clean repeal, and that's what we should vote on again. Now, I am for replacing, and I have a replacement bill as well. Let's vote on a variety of different choices for replacement and see which one gets enough votes to pass. My replacement bill would actually let individuals get group insurance so they wouldn't have a problem with pre-existing conditions. But if they joined a group, like a big association of people, they'd get leverage to lower their prices. But if you give people $14,000 and say, here's $14,000, buy insurance with it, guess what? No insurance will go below $14,000. Before Obamacare, I had insurance for my whole family of 5. It cost me less than $5,000 a year. But the prices have gone like this. We've got to try to let competition bring the prices down, but subsidizing insurance will cause the prices to go up, not down.
That's certainly what some independent analysts are predicting as they take a look at this plan, but they're also predicting that 6 to 10 million people will lose their insurance coverage because these tax credits aren't generous enough. And yet you're saying take them away.
There are different ways you can get people insurance. You can give it to them and pay for it with borrowed money, because we don't have any money up here. They're going to have to borrow money to pay for this. We can't afford the entitlements we have. We borrow $1 million a minute. You can give them money, but that won't bring the price down. Or you can say, how do we create a marketplace where the price goes down and more people get insurance because it costs less? One of the main reasons young, healthy people don't buy insurance, costs too much. So Obamacare had all those mandates which forced the price up, and less young people bought insurance. So really, what we really need to do is believe in what made America great, which is competition, choice, freedom, capitalism, and that brings prices down, and more people will get insurance. We have to believe in what made our country great.
So what happens now? Because there seems to be some confusion about whether the White House and Republican leaders are willing to negotiate with conservatives like yourself or not. What is happening behind closed doors? Are you talking? Are they thinking about taking parts of your plan?
I saw the president said he was open to negotiations.
Have you gotten a phone call yet?
Well, right now I'm reading The Art of the Deal, and when I get through The Art of the Deal, then I think I'll be ready to negotiate with the president.
But until then, you haven't heard anything from Republican leaders?
I think there will be negotiations, and negotiations occur when you show enough strength that they have to negotiate with you. So if they have 218 votes without talking to me, they won't. If they can't get their 218 votes without talking to conservatives, then they will. So the House Freedom Caucus is 40 conservatives. There are 2 or 3 in the Senate that are saying they're not going to vote for this. If we hold strong and we hold together, we'll get a seat at the table. If we don't, and they pick people off one at a time, at that sense, there will be no negotiation. So negotiations only occur when they think you have the power to prevent them from getting what they want.
I'm sure The Art of the Deal also says don't give away your end position. But it sounds from what you're saying that some tinkering at the margins is not going to be enough to bring you along. Simply cutting the tax credits back is not going to be enough to gain your vote.
I've proposed the compromise that I think will work. Separate, repeal, and replace, vote on them on the same day, and vote on several replacement options. And I think there will be some that do achieve bipartisan support, but let's have repeal, and then let's have replace separately. One of the things that's made us so divided in our country is Democrats rammed through Obamacare with no Republican input. Now we're ramming through repeal with no Democrats on board. Why don't we replace with something that actually could bring us together with a bipartisan bill?
But you know how this works. There are just as many Republicans on the other side who say that they're worried that if you cut back Medicaid, that their constituents are going to be in the lurch.
And yet every one of those Republicans voted for the bill 14 months ago. Everybody voted for it. We had a clean repeal bill 14 months ago.
But just a couple of months ago, here's what you said about repealing and replacing.
And I
you
stood up for
tweeted,
repeal and replace.
I just spoke to Donald Trump. He fully supports my plan to replace Obamacare the same day
I still am for that. I'm still exactly for that. Repeal and replace on the same day doesn't mean they have to be in the same bill. So I am for doing them simultaneously, repeal and replace. I would like my replacement bill to be one of the choices. I don't have to get everything I want, but I think we put forward a conservative vision for replace. We can have the Obamacare light provision. For all intents and purposes, we could have Obamacare again. Vote on all of them and see what there's consensus for. If there's not consensus, let's keep working at it till we get consensus.
How troubled are you by the fact that we don't know how much this bill is going to cost, and we don't know how it's going to be paid for?
It's a problem. It's a problem. It should be scored beforehand. We have to know what's in it. We have to know how much it costs before we do it.
Senator Rand Paul, thank you so much. Appreciate it.
Thank you.